This is Shaheen Safiullah from Utah Occupational Safety and Health from the Consultation Division. I've been asked to talk about, all the new issues coming up due to the coronavirus. There are so many OSHA regulations that apply at this time. And let's see. So I have developed in a very short time some safe work practices for contractors during this outbreak. And actually, I did a lot of Google search, went into the CDC website and several other construction-related websites, and really found some useful information that I would like to share with everybody. So what is coronavirus disease? It started in 2019. That's why it has the name to COVID-19. It's a respiratory disease. It's caused by SARS-CoV-2 virus. That's the name of the virus, but the disease is called COVID-19, and it can spread from person to person. And there are many types of human coronaviruses. All of these things I'm also learning new, including some that can cause mild upper respiratory tract illnesses. But COVID-19 is certainly, in most cases, it may be mild, but in several cases, it has been really severe. It's a new disease caused by novel or new coronavirus that has not previously been seen in humans. So what are some of the symptoms? COVID-19 include mild to severe respiratory illness with fever, cough, and difficulty breathing. I'm sure you've heard this now several times. So how can you help prevent the spread of COVID-19? These are just very general information that I'm giving right now. The best way to prevent illness is to avoid being exposed to the virus. Everyday preventive actions to help prevent the spread of this disease will include, distancing yourself between, yourself and the other people, avoid touching your face. The main thing is you don't want to be the host to the virus. This is one situation where you don't want to be the host. And the best way is to keep distance. Stay home when you are sick. Cover your cough or sneeze with tissue, then throw the tissue in the trash. Make sure you disinfect your hands after throwing the tissue. Use the inside of your elbow. Very well practiced, well-known practices that people are already using these. Clean and disinfect frequently touched objects such as doorknobs, computer keyboards, tables, etc. And use a household disinfectant, cleaning spray or wipe, and always follow instructions on the label. This virus spreads very easily. I've heard different numbers, like it's 10 times more contagious than regular flu, or 3 times. Recently, I've heard 3 times more. That's why you have to be so careful. COVID-19 seems to be spreading easily and sustainably in the community, which is called community spread, because we don't know where the infection started. People who are infected through community spread may not always be able to tell how it spreads or where they contracted the disease. It is possible to get COVID-19 by touching surface or object that has the virus on it. And then once you touch that and then touch your mouth, nose, or possibly eyes, then you can get the COVID-19, but this is not the main way that it spreads. And we'll talk more about how it actually spreads. So it can spread mainly from person to person, between people who are in close contact, and the number we all have heard now, within 6 feet. Through respiratory droplets produced when infected person coughs or sneezes, and these droplets land on surfaces and then spread through hand and face, or it can directly be inhaled into the lungs. And currently, there is no vaccine to prevent COVID-19. CDC has some guidelines on how you can disinfect work surfaces. The first preferred one would be EPA-registered household disinfectant. So any of those commonly bought ones that have the EPA-registered mark on it, try to use those. If those are not available, you can use bleach. But it has to be diluted household bleach, and make sure it's unexpired. Because if it is expired bleach and you use that, it's going to give you a false sense of protection because it's not really killing the germs. And CDC gives the ratio of how much bleach to water. And you have to leave it on the surface for at least 1 minute. So the ratio is 5 tablespoons of bleach per gallon of water, or 4 teaspoons of bleach per quart of water. If you don't have bleach, you can use alcohol solutions with at least 70% alcohol. So make sure you have the right concentration. It's very important. Now there is a video on how to wash your hands, and you have heard it often that you have to do it at least 20 seconds especially after you have been in a public place, or after blowing your nose, coughing, sneezing. And if soap and water are not readily available, use hand sanitizer that contains 60% alcohol. So for hand sanitizing, you use 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. So let's look at the video. Okay, so the video, even though we didn't hear any sound, but it did have the words. So hopefully you got the message about, how long you have to rub your hands, how to dry it, and all that using 60% alcohol. Make sure you follow all that. So now we come to what the employers and employees' duties are. So reduce transmission among employees. That's the main purpose. Actively encourage sick employees to stay home. Employees who have symptoms, so what symptoms are we talking about? Fever, cough, shortness of breath, These are the common ones. The employees should notify their supervisor and stay home. Sick employees should follow CDC recommended steps, and we are not going into too much of the CDC guidelines. There will be some at the end of the slide. Employees should not return to work until the criteria to discontinue home isolation are met. So there are some guidelines on when you can stop your home isolation, and you have to go to the CDC website to get all that. And also in consultation with healthcare providers and state and local health departments. Employees who are well, but who have sick family member at home with COVID-19 should notify their supervisor also. And again, follow CDC recommended precautions. So make sure if you are sick, you stay home. If you have a family member who is sick, you also stay home. And in either case, you notify your supervisor. So more on the employer's duties. This is something that OSHA has come up with, that the employer must develop an infectious disease preparedness and response plan. If you look at the publication, I don't have the number here, it's OSHA publication 3990. It talks about, what those elements should be in the plan. But I have a few here. Just implement a basic infection prevention measure. And what that should include is educate employees on the signs and symptoms of COVID-19. Ask employees to take body temperatures before coming to the job site. And then take temperature of employees at the point of entry at the job site. Maybe some of you are already doing it. Limit points of entry to the construction site so that, employees who have not been trained in the safe practices will not enter from other points of entry. And again, provide hand washing stations with sanitizers that will have 60 to 95% alcohol, tissues, and no-touch waste receptacles at the entry point and throughout the job site. And I know just from doing my research, a lot of construction sites are doing these. Maintain supplies of hand sanitizers and wipes inside shared vehicles, cabs, etc., with a bag for disposal of the wipes. Because once you use the wipe, where do you put that? So pre-plan and keep a bag inside your trucks, your whatever vehicles you have. Utilize work practices when feasible to limit the number of potentially exposed workers on the job site at one time. This is actually a key to reducing the spread of this disease by limiting the number of people at the job site. I know it's difficult to do the job completely by, but you have to pre-plan and you have to look at what is the priority right now. This may include scheduling. So you may do a staggering shift, start or end times, or rotate crew access to a designated area during a shift. Stage the job site to stagger work and limit overlap of work crews. Because if there's overlap, you may have more than the number of people that you want to limit it to. Try not to share tools. If necessary, and I know it will be necessary during construction work, you will be sharing some tools. Just make sure you clean and disinfect tools before handing it to others at the job site. Do not share other workers' phones, PPE. Do not share water bottles or water coolers. Maintain good workplace hygiene, including hand washing practices and cough or sneeze etiquette. Maintain distance of 6 feet. You'll hear this again and again about this 6 feet distance from other workers when possible. Sometimes it's not possible at a construction site, like you're performing a team lift. Limit large group interactions and follow these same practices off the job. Because if you are having, different work practices when you're off the job, you may be bringing the disease to the job site. Report symptoms of COVID-19 immediately. If you are sick, stay home, notify your supervisor. If you feel sick and are at work, tell your supervisor. So, okay, let's see. So again, I really appreciate Wadman Corporation for providing these pictures. These are great. This is only from last week. This is a trailer, superintendent's trailer, and only one person is allowed, one at a time. Boot sanitation station. Take your boots off before getting into your personal vehicle. Place them in a plastic bag, seal it, and put other shoes on before driving home. And the way I understood from Wadman is the employees just stand on this, the sole is just submerged in the disinfectant. And that's how when they come in and when they leave, this tub of disinfectant really works to take the germs off. Maintaining safe distance. This is also currently in practice. Spraying down portable toilets with disinfectants 3 times a day. You may even need to increase it if needed. So social distancing, what is that? So you have to have the distance between the employees to limit the spread of this disease. 6 feet is the minimum. No more than 1 employee per vehicle. If a task requires workers to be closer than 6 feet, then the employer is encouraged to do a job hazard analysis for task-specific jobs. What would you do if you have to work close? Then maybe have extra PPE, face mask, maybe face shield, whatever is needed for that, those employees to be protected. When possible, limit in-person job site meetings, use virtual meetings and communication, just like what we are doing now. More of these virtual meetings, communications, are encouraged now instead of in-person job site meetings. Take breaks and lunches in shifts to reduce the size of the group. I have heard in the news that employees were told not to sit together during lunchtime, and they were still doing that, and all of them contracted the disease. So this is something to keep in mind, wherever, if you are on a break, keep your distance from other employees. General contractors should communicate with subcontractors about prohibiting large gatherings. And by that, currently no more than 10 people on the job site, such as the all hands meeting, if you have to have it. So when these pictures were provided to me, OSHA had not come out with the recommendation, which I have now in the text box here. So in addition to the social distancing, you always have to maintain that. But in addition to that, cloth face coverings are now recommended in public settings to prevent the spread of COVID-19 from the individual wearing it, who may be asymptomatic to others. So the problem is, you may have fever, cough, shortness of breath. Those are visible signs. But what if you are asymptomatic and you don't have any of those symptoms, but you are still infectious? So that's why wearing the cloth face coverings is now recommended by CDC. But again, remember, such coverings are not a substitute for respirators and are not a substitute for social distancing. You still have to maintain that 6 feet distance. And if you do need to have a respirator for certain tasks in construction, I know For silica, if you follow the table 1, you may need respirators. Even dust, if you're painting, spray painting, you may need respirators. You have to have respirators and not cloth face coverings. Some best practices that I learned from other contractors is suspend all conferences, seminars. Those are not priorities right now. Meetings, trainings, not to exceed 10 participants. Again, maintain 6 feet distance, no handshakes. Job site crews should not crowd into elevators. Stand back, wait, and use elevators 1 person at a time. Subcontractor start times can be staggered and shift premiums relax. Many owners, contractors are making sure masks, hand sanitizers, thermometers, and other equipment are located in designated places. And enforce disciplinary actions if workers are not following safe work practices mandated by the employer. So what if the employees are entering occupied buildings and homes? Then you may be exposed to the occupants, whatever disease they have, you may be exposed to that. Many contractors and service technicians perform construction and maintenance activities within occupied homes. Although these are not large job sites, they still present their unique hazards involving COVID-19. So some of those professions are plumbers, electricians, heating, ventilation, air conditioning technicians. So those workers should be taught to evaluate the specific hazards. Require the customer to clean and sanitize the work area before workers arrive on site. And technicians should sanitize the work areas themselves when they arrive throughout the workday and immediately before they leave. Also, ask occupants to keep a personal distance of at least 10 feet when you're in the building or homes. And the worker should immediately wash hands before starting and after completing the work. And all of this really should be emphasized by the employer before they even enter the home. Do not accept payments on site, no cash or checks exchanged. Require electronic payments over the phone or online. And again, the main purpose is to not touch, paper, no handshakes, just as limit your touching any object as much as possible. Now, what if you have job site visitors? You can ask them some questions, and such as, have you been asked to self-quarantine? Have you been in close contact with anyone who has been asked to self-quarantine? Have you experienced any of those symptoms, fever, cough, shortness of breath? Have you been in close contact with anyone who has been diagnosed with COVID-19? And if they say yes to any of the following questions, the visitor will not be permitted to access the facility. That's something you should be really enforcing if you want to limit, spread of this disease. And again, CDC has some guidance for businesses and employers. Some of those guidance includes, the employer should frequently check the recommendations, update their job hazard analysis, and your safety plans. Employers should consider designating a representative to monitor for signs and symptoms. So there will be one person at least for each job that will be a representative to monitor for the signs. Another person may be a representative to take employees' temperatures with a digital forehead thermometer. And of course, you have to disinfect the thermometer. If you touch the thermometer on one person's forehead, then you have to disinfect that. And again, temperature is not the only symptom, so it may not be the only means of detection. If an employee is well but has a family member The employee with home with COVID-19, the employee should notify his or her supervisor and then follow the CDC guideline. If an employee is confirmed to have COVID-19, inform fellow employees of possible exposure to the virus in the workplace. I think it's very important for the employer to do that, informing all other employees that one employee has been confirmed. But again, you have to maintain the privacy, the confidentiality of that employee, and follow ADA guidelines. Ask the affected employee to identify other employees whom she or he came into contact with before the employee leaves. If employees have been in close contact, less than 6 feet, with confirmed COVID-19 person, they should self-quarantine. Very important guidelines. Contractors should not pass around a sign-in sheet or mobile device like iPad, tablet, mobile phone to confirm attendance at meetings. Mobile device, iPad, should be limited to a single user. So those are mainly the guidelines that a lot of job sites are following, and OSHA is expecting each job site is going to follow the best way, the best practices to limit this disease from spreading. Now, this is the one question that I was given. I guess one contractor had this question: if COVID-19 virus spread can happen through sewerage systems. I found the answer on the CDC website. It says that it's reviewing all data on COVID-19 transmission. At this time, the risk of transmission of the virus through sewerage systems is thought to be low. And there is not much evidence yet to say whether it can be spread through sewerage system. But as usual, if you're handling wastewaters and sewage, then workers should be given all the right PPE, training, standard practices, basic hygiene, just like you are expected to do to follow the OSHA regulations. Just some bullet points on CDC recommendations for sick employees: stay home. Because most people with COVID-19 have mild illness and are able to recover at home without medical care, but you don't want to give it to somebody else. So you stay home. Do not leave your home except to get medical care. Do not visit public areas. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing or have any other emergency warning signs. And avoid public transportation. Avoid using ride-sharing taxis. And CDC has more details on this. Some warning posters that maybe you can have on your job site. I think warning posters are a great way to convey information. CDC came up with some of these posters. And some of them have the Spanish version as well. This we just found yesterday on Respiratory Protection. Due to the shortage of N95 respirators, OSHA has been encouraging the reuse of respirators, the N95 dust masks mainly. Now, if there is a shortage and respirators are required for the job task, OSHA is allowing extended use or reuse of N95 respirators. But you have to make sure that it is not contaminated, damaged, soiled, and its structure is intact. Otherwise, you'll have to just throw it. Employers also have to have a written program for the respirator, for the use of respirators. Now, in the new guideline that came out yesterday, there is a hierarchy of use for respirators. If you cannot get NIOSH certified respirators now, you can actually use non-NIOSH certified respirators, which are from other countries, and it lists some of those countries. And then you can also use respirators from the Republic of China. And if you cannot get it from the hierarchy that OSHA has established, then you can go to a face mask or a cloth mask. So OSHA is allowing all that. But make sure you have a written program that spells it out clearly, under what circumstances employees are going to reuse a respirator. Make sure that you have good storage. This is something I have seen personally at construction job sites, respirators not being stored properly. So that's something, it has always been enforced by OSHA and it always will be. So make sure that you are following good guidelines for that. Extended use is preferred over reuse. So extended use is when you're not taking it off, you're just using it continuously. And reuse is where you have to take it off and then put it back on. So when you are reusing it, you have to take it off, put it in a proper storage, and then make sure that you use it properly the next time. Always make sure that if you have good engineering controls, work practices, administrative controls, employee training, then you may not even need the mask. So OSHA has always said that use the hierarchy of controls. Employers should, for example, consider whether it is possible to increase the use of wet methods or portable local exhaust systems, or to move operations outdoors. In some instances, an employer may also consider taking steps to temporarily suspend certain non-essential operations. And this is being done actually at some construction sites. I'm not sure about Utah, but in other states, they are suspending some non-essential operations. And again, non-NIOSH certified respirators can be used where NIOSH certified respirators are not available. And using homemade masks or improvised mouth and nose covers only as a last resort when no respirator or face masks are available. But again, these are not PPE, and ideally should be used with a face shield to cover the front and sides of the face. Now, I'm almost towards the end. The record keeping question, I know I've received a lot of calls related to record keeping. Yes, if it is work, if you contract it at work, if you can prove that you did get it from work, then it is recordable. Just make sure you go through the criteria for recording, and you should. This is something the employer should record in the OSHA 300 logs. Okay, I think that's all.
There's a couple of questions that people have. The first question is, you said something about taking temperatures. It's okay to require employees to let you take their temperature before they come onto the job site, provided that we do it safely?
Yes, actually, there is, of course, employee confidentiality issue there, but employers are now allowed to take employee temperatures. Yes, because it's all, the main reason is we don't want a sick employee to enter the job site and spread the disease.
All right, well, that's fantastic to know.
Mm-hmm.
Thank you. Second question, if an employer provides a respiratory protection to employees, are they required to be part of a respiratory protection program, i.e. fit testing, training, medical exams, etc.?
So OSHA's stand has always been, if it's voluntary use, then, it is, if it's a N95 dust mask and it's for voluntary use, then you have to give the information in Appendix D of the respirator standard. And Appendix D talks about proper maintenance, care, storage of the respirator. If it is a required use, then the whole respirator standard applies, which means having a written program, training, fit testing, medical evaluations. So we have not had any directions from federal OSHA that there will be an exception now. So it's the main thing is whether it's voluntary or required or not. That's where the fit testing medical evaluation requirements will be different.
Okay, thank you. Next question, you mentioned that don't accept cash or checks on site. What if somebody were to mail something? Is there a safety procedure there? Do you let it sit for a certain number of days before you open it? Or is it still okay to accept mail if it's not okay to accept something handed to you on paper?
So again, you know, these are new things that we are learning as we go. Currently, CDC doesn't have anything on this. All we have been hearing is on cardboard, the virus can survive for 3 days. On paper, I'm not sure, maybe 2 days. What some good practices can be if you use maybe a spray, a disinfectant spray, and spray the mail without, you know, maybe deleting anything, ink or anything on the envelope, or you can leave it for a few days if that is possible. These are just guidelines, nothing that we can say for sure is going to take care of the problem. But that's the best we can do right now.
All right, thank you. One other question, would you be willing to send me this PowerPoint so that I can send it out to everybody who attended today's meeting?
Yes, definitely. I can email this to you.
Yes. All right. Perfect. And then I am having another question. Somebody missed the talking about taking employee temperatures. Could we repeat that for them? It's okay to take their temperatures provided you do it safely and
yes.
privately?
Yeah. Yes. Yes. Employers are actually told by, this is covered in the ADA. And there is an ADA website, I think eeoc.com, where it talks about the employer's right to take temperatures. So employers should be able to take temperatures as long as you know, the confidentiality is maintained, because it's very important to know if a person has fever and then take the necessary steps after that.
And could you go over the safe procedure for taking temperatures again?
So yeah, if you have to use something that is, you know, like a forehead digital thermometer. So you lightly touch the forehead and then you disinfect the thermometer after each use. Make sure you have the EPA registered disinfectant, or maybe read the thermometer, the manufacturer's instructions on how to disinfect it. Soap and water is the best. You know, it will kill the virus. So you can use soap and water, which may not always be possible, or just a EPA registered disinfectant.
All right. Well, thank you, Shaheen. Are there any other questions from the group before we turn the time over to Joey, our Vice President of Operations, here to make a couple other announcements?
Well, thanks for being and allow me to just step in just for a few minutes. I wanted to just share with the group. I know we got a number of folks that are participating with us, but I wanted to make sure you're aware of the AGC resources that are available to you. Much of what Shaheen has talked about today and putting together a comprehensive plan is available on our AGC website at www.agc-utah.org. Right within that page, on our COVID-19 page, we have a prevention, preparedness, and response plan available to anyone. We've been working with many of the county health departments They are referencing our health plan in their documentation. So again, it's a very comprehensive plan that you can review as a member and as a non-member to utilize for your use, and share it with as many folks as you'd like. But it contains all of the information that Shaheen has talked about, and takes it a little bit further as far as maybe on
Do you have
additional
more
items
questions?
such as job site trailers, how to again protect guests and visitors and those types of folks. So again, that's available on the AGC website. The other thing
David?
available there that, oh, go ahead, Shaheen, sorry. Shaheen, sorry. Well, let me just continue. So under the website there as well, we also have all of the county health orders. As you are working in different areas of the state, make sure that you're reviewing those documents to see what maybe those jurisdictions may be requiring in addition to either your already current plan or the plans that is available within the AGC website. Also within that, if you do UDOT work, UDOT has also their requirements and health standards as well. And all of that is available on the AGC website. I want to clarify one item under the boot washing requirement. I know that some counties, we've been working with them on that specific requirement. We've had a number of members that have been concerned about that and how to implement that. In all of the county health orders that are currently issued and that we're aware of, all of those have been changed to a should and not a shall or a must. So just want to make that clarification there. But anyways, again, I would encourage you to go to the AGC website, take a look at that COVID-19 plan. It has all of the information that Shaheen has talked about, and again, some additional scenarios that might be of assistance to you there. With that, Taylor, I think that's all I have.
Question for Shaheen, Joey, anybody else? Where can we get hand sanitizer, masks, etc., for our workers at this time? Is there any resources if you are running low on PPE? Where can you get those?
Oh boy. Okay. So just your regular suppliers. Really, we cannot endorse any company, and wherever you can get it from. I know that certain construction companies are ordering big gallons of disinfectants, but you'll have to do your own research and find companies that are supplying those. Sorry, I wish I had a better answer for that. You do need to have disinfectants for work surfaces, definitely. If you can't get sanitizers, get the bleach. But for hand, CDC does not recommend using any type of bleach solution. So make sure you have the alcohol-based, 60% alcohol for hand sanitizer, or the EPA registered disinfectants. But yeah, you can use bleach for work surfaces.
So one item that we are working on and have been, we've had this question on a couple of items with regards to the hand sanitation. As Shaheen has mentioned, hand washing is definitely the preferred method and the most effective method. But if that is not a likable source or reliable source for you on your projects, there are some local distilleries in Ogden, Salt Lake. I will mention the one in Salt Lake, Beehive Distillery. So many of your alcohol producers, they are making hand sanitizer and are selling that in addition to obviously the spirits that they normally sell. But I would reach out to your local distilleries and see if they are offering the hand sanitizer. I know they're selling it here in Salt Lake and Ogden as our last report. So I will say that about the hand sanitation. On the N95 and on the mask, we have been working, or will be working with many of our members to see who may have excess. Of course, we've been asked to give those to our first responders, but some of our employers have reached out and said that they are in need of some as well. And so we are looking to see what sources might be available on a share basis, not for shared use, but if a contractor has extra that they can provide to another contractor, we're looking at that as an option as well.
Thank you, Joey, for that answer. All right, so that's all the questions I have down here. thank you again for all of your participation and everything else. Shaheen, could you just do one more thing? Could you give us contact information if anybody has a question later where they can contact you, or also for
Yes.
compliance for OSHA?
Do you want me to just email that to you?
Yeah, that would be fine. If you'll email it to me.
Okay, so I'll just email you my contact and compliance contact, and then you can use that whenever necessary. If anybody has any specific questions, with the respirators or anything else, they can call me directly at this number also.
All right, perfect. Well, thank you everybody for coming today. I really appreciate it, and have a good day and stay safe.